the normal types of looks of boobs, because there are normal ways and then there are abnormalities that you might need to worry about. So we're definitely going to get into that, but let me go ahead and get this picture for people to kind of see it. What they saying?
It's all titties need love. Yes. I met a lady once. Her boobs kept her knees warm. She was 23. Oh, bless her heart. I do like milk. Always wondered what Wendy Williams looked like. You really wonder that? Really?
Oh, that's.
Hey, no judgment, because hey, to each his own. But
that don't seem like it's appealing.
That's just one set. Like I love boobs. Like I'm even wearing a bracelet that says "I love boobs."
Oh, I absolutely love looking at them. I love touching them.
Right. I love my own. I love other women's boobs. Like I am an admirer of boobs, but that's one set that
I'm not interested in.
I'm not. I don't want to see those.
No, you can have that. I think I got the picture now. But you can have that. I don't want to see what her set looking like.
Right. No, pass. Malcolm, no lie. Titties make the best pillows. See, I can imagine. I can imagine that.
Here we go. Here we go, people.
So those are 6 different sets.
Now, y'all see them things buck-eyed.
You see the East and West?
Them buck-eyed breastises. This don't make no damn sense. But you know what? Some women got that. How does that even look when you're naked?
Right. I see East West. I see asymmetric. I said that already. I see bell shape. What else?
Now I can. This might be me at the bottom, kind of like that. Might be in the middle. It's probably
the athletic. I imagine those are the athletic boobs.
Yeah. So I'm gonna say like I look like a boy at times. Sometimes if I don't wear a bra, it's just sometimes it's there, sometimes it's not, and I just be struggling. Oh, baby, I talk about my own self.
I would hate to have that bottom right set because it damn near looked like all one set of boobs. Like, I mean, just one.
That looks, you know what?
There's barely any separation in those.
That's like men. That's how the men be trying to have chestises. That's how the men be looking, trying to have male boobs and stuff. That's what the men be looking like.
I would be upset if I had those boobs.
But I can't imagine having that big ass titty on the right, then you got that little baby. Like at least
that's the asymmetric boob. One boob is larger than the other.
But not that much larger. Jesus. They ain't
some ladies are a whole cup size different, size. That would fucking suck because can you imagine trying to get a bra? It's hard enough to buy a bra that fits your boob. But if yours were the asymmetric and there was that much difference between the two, like could you imagine going bra shopping? I would be pissed off.
Oh, I would be too.
You gotta stuff one side and not the other.
Girl. Okay, so I want to say what are the most common and kind of you already broke it down anyway. So
so there's normal differences that you shouldn't be alarmed about. Do you have some of those or do you want me to go?
I had this basically, it's kind of like what the shape and everything will look like. Let me take this off. Normal breasts, the shape of the normal breast, the breast is shaped like a pear and the tail of the breast tissue extends under the arm. Some women have breast tissue that can be felt in the armpit. You might have some more steps, but this would be more noticeable also during pregnancy. So some women can kind of have a lot of tissue up here. And especially, I've had the issue sometimes depending on, we can get into the abnormalities, but it's depending on what you use and like deodorants and things like that can make things change in your breast tissue and things like that. A lot of things that we're going to get into that will kind of educate you a little bit. Not everything is cancer, but there are things that can be noticeable in your breast as well, just to kind of be, understanding of what's going on with them. But you got anything?
So some of the normal differences that you might see that you should not be alarmed about is of course, we went over if your boobs are slightly different in size. If one's larger than the other, that's normal. Lots of women have one boob that's larger than the other. One boob hangs lower than the other. That's another normal difference. If you have hair around your nipples, and sometimes when you're older, you know, a 40 and up crew, like all of a sudden you hit 40 and there's hair sprouting everywhere and you gotta pluck them or wax it or whatever the case may be. However, hair around your nipples is normal. And then if your boobs hurt or feel tender before or during your period, that's also normal.
Okay.
Those should not be cause for alarm. Now, there's the unusual changes, stuff that you notice that you should probably get checked out on. And I think that's what we're going to talk about next.
Okay. And I got some things on that. Well, actually, like with my nipple, I have the big, you know, and then I have like bumps. It's like little, you know, it's like, I don't even know what to call them, but they're
like braille.
Yeah.
Lick here.
There you go. It's like lick here and find the tunnel. It's like braille. So you know what I'm saying? I have that going on. And
yeah,
you know, to somebody that don't know, it's like, you know, it don't look bad, it don't look crazy, but I've noticed that's the difference in my nipples, that I have that braille going on. And
yeah,
you know, I like to walk around naked. It don't matter to me, you know.
Me too. Oh my God.
So either you gonna get it where it hang low, hang up tight, go this way. I don't care. You just gonna like it.
Look, my girls know, and every time you think they've been used to it by now because it's been years, but now they're like, "Mama, put some clothes on."
Oh no, not the Cardi B. No, not that big.
Now I thought I had big areolas, but Jesus, when I saw hers, I was like, well, damn, mine are normal compared to hers.
Yeah, that was okay. Well, we ain't gonna wait. I'm gonna find it. We might post that up. We might send it to Maggie.
You're gonna get us to put in Facebook jail.
It was just a little nipple.
Jesus, yeah, her areolas are rather large.
Yeah.
But the unusual changes. Did you have any other unusual changes?
Yeah. Some things you can't help, like basically, where is it? I cannot feel it. I swear I can't never unusual. Here we go. Unusual changes can be certain things that, like we basically said, that you get some help about, because if you're seeing these, then it's not normal. It's definitely not normal. Let me put that title up. The unusual breast changes. There's a thing that's such thing is called fibrocystic breast disease. And it's non-cancerous, but it changes the way it gives a breast a lumpy or rope-like texture. So symptoms may include breast pain, a breast lump, because some people will feel a lump and automatic, oh no, it's cancer, but not all lumps are cancerous. And it can change in the breast texture as well. So it might be hard to touch, things like that. You just noticeable, because I know sometimes when I might end up getting a lump, and we're gonna go into that, but it can be like right up under the armpit, and you can feel it as you're moving around. I've had that before, and of course, I went to my doctor. She was like, "Lay down off the sodas and the caffeine. There's just certain things you have to do for yourself. Like, people don't realize what you put in your body affects every inch of you, literally." So I was like crazy on the sugars and the sodas, and she was like, lay off the damn sodas and lay off the certain, choose a certain deodorant.
Yeah.
Because certain deodorants will also cause that discomfort and causes lumps. Some people get that too. A lot of people don't know that. And then of course, breast cancer, discomfort, breast lumps, skin redness. So you'll start seeing like redness in certain areas. And I think, isn't it where I can't remember, when you touch it, it's a certain, because the regular lumps is like hard, but I think breast cancer cells, it does. I just gotta read that a little bit more, but Also, menopause. Menopause can change your texture of breast, and of course, pregnancy. But menopause, you can lose loss of your scalp hair, early awakening. Your hormones kind of, like you said, 40s and 50s. That's more of your hormones. You're declining in that. So menopause can kind of change the way your breast shape and things are. Of course, it's not going to sit up so high after a while. It is going to kind of drop a little bit. So.
Now, what I didn't know about menopause was that up to and during menopause, the glands that actually make milk, they shrink when you're leading up to menopause, and when you're in menopause, they shrink. But they're replaced by new fat tissue. So sometimes when you're leading up to menopause and during menopause, your breast cups can actually go up a size, because in response to those glands decreasing in size, you're getting new fat tissue to replace. So sometimes your boobs get bigger leading up to and during menopause. So that I didn't know. That was one thing I learned. But some other unusual changes. So if you're doing self-checks, which everyone should be doing, if the lump is firm.
That's what it was. Okay.
Yeah. Okay. If it's firm and you've never felt it before, you should get that checked out. It could be nothing, but it could be something. And early detection is better than later detection. Swelling around your boobs and your collarbone and your armpit.
Okay.
If that's swelling all of a sudden, that's a reason to go get checked out. If your nipples are dry, cracked, red, or the skin around your nipples have gotten thicker, think like an orange peel, then that's a cause to go get checked out, that your body is responding to something abnormal, so go get checked out. Also, if you have blood or fluid, any fluid besides milk that's leaking from your nipples, that's a cause to go get checked out. And then last but not least, if your breasts are warm to the touch or they itch, that's a cause to go get checked out.
Okay. And then, and that, like you said, that redness and that, I used to breastfeed, and my God, when that milk gets in there, it gets like you going to work and that thing you can't pump and they fill up. I can see, like, I'm so light. You can see the veins in my breast, and it was just
that pain, Jesus.
And it'd be like the way them babies be with them damn gums, whole nipple was red and
cracked and all of the above.
All of the above. So I definitely know all of that. And then he want to get all, come on, baby. No, these things here. Because you can't even get in the shower or nothing. They're not for you. So
yeah,
couldn't even put warm water. I'm so glad no longer.
Yeah, man.
Yeah. So it does suck. It does suck. And those areas are sensitive, so you have to, don't be going in here going crazy like nipples. This whole area. It's just a little sensitive. Just a little sensitive. Don't be going crazy, especially with bigums over here. Y'all just be going crazy.
Like, fuck. Never mind. I'm not even going. We'll get to that. We'll get to that during the nipple sucking portion, because I have a whole rant. I have a whole rant during that.
Now, won't y'all call in for the nipples? Come on, call about your love for titties. We want the men. This is the episode that the men supposed to be calling in about some titties. We're gonna get into this.
Cookie by Nature, would you recommend breastfeeding? Absolutely. For lots of reasons.
Oh yeah, because it gets
number
easier.
One, it helps you lose that weight that you gained during your pregnancy. It helps you lose it faster. And maybe the most important reason, aside from the reason that I just named, is that it's extremely healthy for your baby. Like that formula and that's literally man-made shit. So I don't recommend that for if you can at all help it. Now, no judgment, what you choose is what you choose. But breast milk is absolutely best for your baby. you know,
especially that
most
first,
importantly.
that even like, 'cause when my sister just had her baby, she's 10 months now. But, of course, my kid's big, so I forgot all about just that first little piece, little bit of you can give to your child is the most crucial thing that you can do for your baby. Because that's all the antibodies.
Yes.
It's everything that the baby needs is coming out of that. So it's not even like milk. It's just like a little something. It's like a little discharge or something that it gives. They recommend it. That's why they'll be so quick to say, hey, put the baby on the mama's chest, because that's the best thing you can give other than shots and things like that. That's the best thing you can give to your child.
Yeah, it's extremely healthy for your baby. Now, as far as how it helps you lose weight, I won't claim any, you know, technical, do some research because I haven't done enough. But I did back then. And that was my reason for, other than it being healthy for my child. But when I read that it helps you lose your baby weight faster,
definitely,
I was like, okay, yeah, I'm all for it. I'm in.
because it does. Because not to cut you off, but what it does is it makes the uterus contract every time you breastfeed. It makes the uterus contract more. So now you're getting rid of all of that placenta and things that, you know, still trying to come out. And, you know, push all that. Because, you know, a lot of people don't realize after a baby, you still have, you know, those weeks of healing. And you're still passing, you know, passing all of that out. So anything that can make, like, if anybody breastfeed, we need women that breastfeed in here talking about this. But I breastfed, and any woman knows they can feel, you'll start feeling that contraction. And it's like almost like a, you know, a period or something like that. It feels like that. So women, we look, we're amazing. Our bodies are absolutely amazing. And for anyone to give that mama hell.
Yes, Keith, that's what it is. The colostrum. That's the beginning of your breast milk. Yeah, that was extremely healthy for your baby. And that alone should be reason enough for you to be like, okay, yes, I'm a breastfeed, because you know, that man-made formula is not as healthy as your own milk that your body produced for your child.
Well, you know, that baby gonna get pissed off at you because
the way
my niece be set up, both of them, she'll go from here. Okay, I'm done with this one. I'm going over here.
Yeah, and you have to do both, because if you only breastfeed on one, guess what?
Gonna get.
One titty is going to be the producer of milk. Your other titty is going to not produce, and you're going to have one huge ass titty and one little bitty titty. So no, Malcolm, you're going to have to sit your ass down until that baby is done breastfeeding.
Yep, let's go. That's right. Breastfeeding helps uterus reduce back to its
pre-pregnancy state. Yeah.
As well as breastfeeding, cut my bleeding, and there you go. So it's kind of speeds the process just a little bit.
All kinds of benefits with breastfeeding.
Yes. So we wanted to get into the higher risk for breast cancer. Well, we all know the main factor could be genetics.
Yes.
So especially if you have a close relative. I have an auntie that she beat cancer. She caught it early, but because of that, you know, and it's crazy because our job had like a mammogram type of free day or whatever, but it's crazy that you have to be of a certain, like if it's your mother, if it's like your immediate family, you can go get it tested before a certain age. But if they don't consider you higher risk, you have to, like, I've learned that you have to wait to a certain age to go get your mammogram. But because my auntie did have it, I felt I wanted to go ahead. The job is offering it for free. Why not? You know, but they was like, nope, your doctor has to refer it if they feel that there's really is a need for it. That means we got to self-check, ladies. We have to self-check, especially when you can't go get that done. But I need to know. You know, I need to know. You know? So make sure y'all go into what are they considering like a high risk for breast cancer. You have anything?
So yeah, higher risk for breast cancer if you smoke cigarettes. or if you vape tobacco, that makes you a higher risk. If you drink alcohol regularly, that makes you higher risk. Or like you mentioned already, if you have a family history of breast cancer, that makes you a higher risk. Now, this is what I didn't know. Women who don't have any children, or if you have kids after the age of 30, you're at a higher risk for breast cancer. I did not know that. Also, taking certain hormone drugs, so birth control, or if you're in the older age group, if you take certain hormone drugs for menopause, that can make you a higher risk as well.
As well as I see here, basically you had previous radiation treatment. Can cause women who had therapy on the chest or breast, like for treatment of lymphoma, before age 30, you will have a higher risk of breast cancer. And then there's certain drugs, like you said, birth control. There is some drugs back in the day where they used to give to pregnant women, of all things, that used to, it said between the 1940s and 71. So if you're older on here and you had a baby in the 70s, they used to give these medicines that would put pregnant women at higher risk for breast cancer. Why would you? Why? Right. Why, and that to me, that just kind of plays into what people say sometimes, that these doctors don't care about a pregnant woman at times. There's so many deaths that's happened, but that's a whole nother topic. But
right.
Then we want to get into how to lower your risk, because those are some of the things. So kind of look into your medicines and things, and what you're doing. Like you said, everything you put in your body can take effect of breast cancer. Honestly, cancer is just common now. You can damn be the healthiest person, to be honest. So that's a high risk, but it doesn't mean it's going to prevent it from happening. It just may slow it down, maybe. But if cancer is going to find you, it's going to find you, unfortunately.
Yeah. So
self-checking, and a lot of people don't know, with self-check, you have to lift the arm all the way up, and you kind of feel, the women, they get the, go get their annual checks. The doctor will do that. He'll, or he or she will press around all up in the tissue and everything else. But ladies, get in the shower, raise your arm up and press. Just press.
Shower is best.
You want to get all up under the tissue up here. You want to get underneath. You want to get around the nipple, and just press and feel for lumps. And like we said, there are certain types of lumps that may not be cancerous. But if you definitely notice something and it's firm and it doesn't go away, because I know certain lumps, if it's not regularly like a benign one, it will move. But it's certain cancerous ones that will just be there. And and of course the redness of the skin. So things will show itself that something is not quite right. Go ahead.
So Raphael said, just want to shout out all the queens. Your strength and courage as women never cease to amaze me. Salute to every survivor as well as just every woman. From a humble man, bless the tatas and foot cancer. I know that's right.
And I like that. I have done the genetics testing, and I'm a high risk for breast and ovarian cancer. And I haven't done that.
Wow.
I have not done the let us know. Call in. Let us know. Kind of educate. If you're more aware of that, educate some women on what that is, because it could be something that we need to be doing. Because I didn't even know that they had that. I mean, I know, of course, if you feel like someone in your family immediately, then, you go check yourself out. But I didn't know they actually had testing for that. Harlem Shake titties. That's so crazy.
So some other ways to lower your risk of breast cancer is to limit alcohol to one drink a day or less. Quit smoking. If your habit is smoking, quit. Especially if it's nicotine, cigarettes. Y'all have no idea the poison that you're putting in your body. Or maybe you do and you just don't give a damn. But please quit smoking.
Yeah.
Okay, I didn't know this either. Stay at a healthy weight.
That's what I was looking at.
Yeah, get at least 150 minutes of moderate exercise a week. And that doesn't have to be treadmill. Hey, if you have vigorous sex and you have it often, then shit, get your exercise that way. Because I mean, who doesn't want to burn calories by having sex instead of getting on a treadmill? Me, I'm all for that. And then, of course, we touched on this too, healthy diet with plenty of fruits and vegetables, because a lot of people don't understand what you put in your mouth affects everything, your whole entire body.
Did you mention hormones too?
I did not mention hormones.
They said basically, some people have to take certain hormones, especially long term. That can definitely, a lot of people didn't know that, like forms of replacement therapies that includes estrogen and taking these during menopause can raise your risk of breast cancer when taken for more than 5 years. So, and we also, of course, the birth control. And then, like you said, I think you mentioned this before, having your baby after 30. Did you mention that? Okay. Yeah.
I did. I did know that puts you at a greater risk for cancer if you if you've never had kids, or if you wait till after 30 to have kids. I had no idea about that.
I didn't have that idea. Yeah. So do your research, people. We can only tell you, but it's so much out there that we need to know about, to be honest.
Right. Yeah.
I lost one of my dearest friends to breast cancer, Yolanda Clark, wonderful woman that was so strong to her dying day. As Nikki stated, smoking was the issue. Please stop it. Yeah.
Y'all have no idea what they're putting in the fucking cigarettes. It's not just the nicotine that, gets you however it makes you feel. It's not just nicotine in there. There's all kinds of other shit that they put in those fucking cigarettes. And that's one of the things I can't stand. I can't stand cigarette smoking. And I don't know if it's because my mom was a really heavy cigarette smoker up until the day she all of a sudden got saved and she quit cold turkey, and she was a 1 to 2 pack a day type of smoker. So when I was a young kid, I was used to it. That's just what I was used to. I was used to the smell. But when she quit,
smelled a whole different
cold turkey. Ever since that day, from then going forward, that is the one smell that I absolutely cannot stand. I cannot stand the smell of cigarette smoke. And I don't know what it is, but just learning about all the shit that they put in those cigarettes, it's not just nicotine that you're smoking. It's crazy.